Dr. Bill Adams here, and this is No Spin Live. We've got a great show for you today. We're going to be talking about the most popular plastic surgery procedures, removing buttock injections, and breast implant illness. We've got a great team of experts to share some insights with you. Dr. Jason Posner from Boca Raton, Florida. JP, Dr. Craig Coville from Toledo, Ohio. Last but not least, Dr. Christina Mori from Boston, Massachusetts. This first story comes to us actually just hot off the press. It's about the most popular plastic surgery procedures in the United States. Jason, lead us off.
So, I read through this. We get these statistics every year from both ASPS and ASAPS. And you know what? I don't really concentrate on the numbers. I concentrate on the trends. And we really need to see, and basically the trends haven't really changed. Minimally invasive things are as strong as ever, if not a little more. It's just as you expect. Botox and fillers are the highest things. Microdermabrasion, chemical peels, laser hair. That's been pretty much the same for the last 10 years on the non-surgical side. And on the surgical side, pretty much unchanged as well. The most popular procedures are always breast implants and liposuction, and there's always slight variations into what's up 1% or 2%. But, I don't think things have changed that much over the last, few years in terms of these trends.
Well, I think trends are important. I agree. But I also think that basically that's been the same trend, that non-invasive and injectable, which I think are invasive, are extremely popular. The surgeries are also popular, and the reason they remain popular is that our downtime with surgery is so much less than it used to be.
I think, first of all, who's answering those questionnaires? Not everyone's responding, so I'm not sure that all the kind of categories are actually representative of what everyone's doing. I was wondering if maybe liposuction was up because they're doing a lot of Brazilian butt lifts and you have to have liposuction with that. That's one of my thoughts, why that's always up near the top. But in general, as far as I'm concerned, I've seen a huge boom continually in the labiaplasties and now vaginal rejuvenation, surgical and non-surgical.
So I don't know, Jason, are we, you say it's kind of same old, so do we need to change it up maybe, or what do we need to do?
There hasn't been any real changes in new technology that's really changed the paradigm for us yet. So, I think non-surgical things are getting better. The tightening is getting better. I think the whole non-surgical vaginal rejuvenation, the hard data is really starting to roll out now, that there's really good hard data that this actual procedures actually work. But the bread and butter for me is always the same couple of things, breast, lipo, face, tummy, same stuff I always do, eyelids.
Yeah, good stuff. Well, we'll keep our eye on it. We always like to have our finger on the pulse of the newest stuff coming out, and I think that's certainly one thing we'll keep covering on No Spin Live, because you guys always know the newest and hottest stuff coming out. So, well, let's move on to the next story. This was I don't even know who this person is, Kay Michelle. She went on Dr. Oz, who I guess Dr. Oz is under scrutiny himself, I think, from people calling him a poser or something. But she apparently was showing this consultation and removal of what she says was buttock injections. So, there's a lot of things I guess we can talk about in this story, but what do you think?
I'm like, what was in there? Because look, if it's fat, you can suck it out. Like we've done that. I actually did a body tight on some buttock fat the other day that sort of melted the fat and tightened it. If it's Sculptra, you got to wait till that stuff goes away. If it's stuff from the hardware store, I don't think we're getting that out anyway.
Right.
What do you think, Craig?
Well, if she's got an injection, she doesn't like it, there's very few options, especially if you don't know what it is. If you know what it is, you can be a little more direct. But excising some of these things that are walled off from inflammatory processes, probably the only way. It's not great news. It's, again, somebody had something done that's pretty on the edge, marginal in terms of how it works. So now she has a problem. So now she's finding somebody that can help her, a plastic surgeon.
The person putting fat in your buttock needs to know what they're doing there as well. So I don't know, what do you think the take home is here?
Well, I think the take home is what's going in there and what's stretching the buttock out is going to have some effects over the next couple of years, whether it's fat or filler. I certainly think that fat is right now very hot, and at normal volumes I think is a good idea, but I'm going to wonder what's going to happen in 10 years to everyone's very large buttock now, and whether their skin will be stretched, what's going to happen as they age. It'll be interesting. But fillers, I don't think it's an economical, feasible project. I think sculpture, like you just said, is very unpredictable. Also, you can't remove it. You can't really dissolve it. And I just don't think it's a good idea putting needles in and who knows what substance in the buttock.
Yeah. But, Christine, let's go back to, so you got a lady who's in her 40s, who's a runner, who's, no body fat and wants her butt made a little bit bigger and has the funds. To me, the only thing for that is if you have no fat, sculpture will give you some result, but, buyer beware in terms of your pocketbook.
Right. I mean, how many vials have you seen having to do?
4 to 8 or more.
I would think more.
Yeah, depends. You start with 4 to 8. I mean, up to 16, I hear, but I'd rather do smaller sessions and do a couple of sessions. But, we do some of it. It's not the huge part of our practice. If someone asks, I do it. I don't really push it. But you're finding some people out there, as Craig and I were talking about earlier, that are really pushing this in their practice. But it's expensive.
All right, so this last story, on the topic, we talked about this before, but it's stuff that comes up and patients hear about breast implant illness. This article that came out was interesting, I thought, for several reasons, but what do you think, Christine?
Well, I mean, I talk to my patients and I believe that there's no diseases caused by implants, just because we know about many different kind of silicone implants, whether it's hip, breast implants, there's no real data that it causes any disease. And I believe that, and I'm troubled by the fact that constantly we're getting stories that this is a possibility and people are blaming the implants on other bad luck, genes, environmental factors, and not necessarily these implants.
What's your take, Craig?
I think it's very complicated. I think that in this article, there's a TV video. It's 6 minutes. First of all, the one girl was young. She was active. She ended up with lupus. Now, a certain number of young women are going to end up with lupus in their life. So did that come from the implant? Well, we've had studies for 15 years that have not said that. So it's unfortunate that this lady had implants and then had lupus, and the other lady had a failed implant. I think that's a different situation. So they didn't really come up with anybody that didn't have a reason. And that the other lady saw all these patients, or all these people, but no one got an MRI or thought to think about the integrity of her implant. Now, we know that broken implants don't necessarily do this either, but these were two more unusual circumstances than a lot of them.
Jason.
Okay, so let's kind of go through this. Old ruptured silicone implants cause a local mess, right? We all know that. Have they ever been linked to any systemic illness in terms of all the studies that we've seen? No. Okay, I've seen twice in my career pulled out saline implants with fungus in them. Now, that's happened when they had open fills. I have not seen that for years. Could that make you sick? Yeah, I'm sure that could make you sick if you got some fungus growing in your saline implants. But I haven't seen that for over 10 years, and I've only seen 2 in my life. The problem is there are some plastic surgeons out there that are reputable, that are going out there on the internet talking about this breast implant illness in order to get patients in, and they're scaring the public. There's good studies on this. I really don't think there's anything to it. The other aspect is I'm seeing some women in their 50s coming in saying they're tired. They've had their implants in for a number of years. And frankly, I just think it's menopause. Hormone changes, your body's changing a little bit. Don't blame the implants, blame your hormones.
That's certainly possible.
Agree.
It's an interesting subject. I think that we're going to keep talking about it, because I think that there's definitely a subset of people that feel strongly about it. So I think it's important. It's important to kind of continue communicating. I think educating.
Well, Bill, if somebody wants their implants out and they're convinced that that's what the issue is, then I would take them out.
Yep.
But I think then you really have to see what goes on for the next couple of years, and if they feel better, that's great. But there's thousands and millions of women that feel better with their implants in. So I think there's two sides to this, for sure.
All right. Well, listen. Awesome insights from you guys. Thanks so much. I know our viewers really enjoyed it. And if you want to see more of this, you can see it on theplasticsurgerychannel.com.